Now I'm going to review some neck or cervical anatomy on an MRI scan to teach you a little bit about what goes wrong in the neck and what's a typical source of pain in the neck. First, let me orient you to the image here again. This is the back of the person's neck. This is the front. These are all different images here. If you look again at this part here, you can see the little bones in the neck or vertebrae in the neck. Each of these is a different vertebra. They are numbered from above down. This happens to be the second cervical vertebra, or what we call C2. That's 3, 4, 5, 6, 7. 7 is where we end the counting of the cervical vertebrae. The next one is the first thoracic or dorsal. We call that T1, 2, 3, 4, 5, and so on. This is an image with a person facing that direction. If you look at this gray stripe right here, this is the spinal cord. This is one of the things that's unique about cervical MRI scans, of course, is you're looking at the spinal cord. In the low back, spinal cord ends just at the top of the low back. So most of what you see is nerve roots. But in the neck, the spinal cord exists, and that has important implications in terms of pathology, how you treat it, when you're surgical, when you're not, etc. In this case, I want to point out a little white space here. That's the space around the spinal cord in the back. There's a white space in front also. You can see that there's a little bit of break in the white space by virtue of this little darker bump. This is a little disc bulge or herniation at that level. Got a little bit of disc degenerative change there and there as well, but nothing very severe. You can see these discs here have good water content. They're light in color. There. These are a little bit darker perhaps in here, there. Not quite as white as there perhaps, but not very severe. It looks to me, however, like there's a little bit of spurring going on here. These are degenerative changes. Sometimes doctors refer to these as arthritis. In that sense, we mean arthritis in the sense that it's osteoarthritis, meaning wear and tear or degenerative changes. I prefer to use the term degenerative changes because people seem to know intuitively that degenerative changes are to be expected to some extent. In fact, these are what I would term age-appropriate degenerative changes for somebody in their 50s. Nothing very severe looking here. She also has a still intact somewhat of a cervical curve, which correlates with less pain than somebody who's lost their cervical curve. So there are a number of things we're looking at when we're assessing a cervical MRI scan. We're looking at pressure on the cord. There's no significant pressure there. I'm not going to show you the cross-sectional images where we would look down the central canal. In this case, there's not going to be any significant pathology, and that's a little harder to read. This is much easier to see for a layperson. So that's it for the MRI scan on the cervical spine.